Okay, so now we're getting to labor. So we're going to be talking about the stages of labor. That would be early, active, and transitional labor, which is all stage 1. Stage 2 is pushing, and then stage 3 is the delivery of the placenta. And we're also going to be in this section practicing the breathing techniques for stage 1 labor. So first of all, you're kind of figuring out, like, what's the difference between true labor or false labor? When do I go to the hospital? That's one of the concerns we mentioned in the beginning in the 3rd trimester, is not getting to the hospital in time or getting to the hospital too early. So when you think it's time to go into labor, you kind of go through this checklist. Both true labor and false labor are irregular in the beginning. So in the beginning, you probably really won't know if you're in labor right away. But it doesn't matter, because you're not worrying about premature labor. You're not trying to stop it. So if you don't know you're in labor for about 6 hours and you're still at work or doing normal things, congratulations. Because that's 6 hours you don't have less of the labor. I'll give you an example. My son, who had his baby here at TMC, this is actually a picture of my son and his wife and his baby. They had their baby at TMC a couple years ago. So I was teaching a blast class that day, and she was 39 weeks pregnant. And he called me and said, you know, she's having contractions. And I said, well, how close are they? He said, well, they're not that close and they're really easy. And I said, well, you're probably not in labor. Then I called him at lunch and I said, how are you doing? And he said, well, they're really easy, but we're still having contractions. So we're going to go out to lunch at Maynard's, and we're going to go walk around downtown. And then I called him when the class was over, and I said, well, how are you doing? He said, well, we're still having contractions, but they're really easy, and we've been taking showers and resting and napping. And I said, okay, you're in labor. That's it. You're in labor. So I said, oh, call me later. And then he called me at 7:30 and said, they're really strong. I said, okay, go to the hospital. So that's it. So that's typical story. When labor starts out for real, later you'll be able to backtrack and say, oh yeah, it began, 6 hours, 12 hours earlier. But you don't really need to know right away. As long as they're that easy and far apart, do your normal routine. Sleep, eat, shop, go to the movies, whatever you want. So as the day goes on, you do know a difference, because if it's real labor, they're going to get stronger and they're going to get closer, and they're not going to go away. Whatever you do, they're not going to go away. So, but it's still too early to go to the hospital. You don't want to go to the hospital until they're closer. They're about 5 minutes apart for 1 hour, and they're about 1 minute. And here's a nice way to remember that. 5, 1, 1. You want them to be 5 minutes apart for 1 hour, and you want the contractions to be about 1 minute. When you reach that criteria, it's time to go to the hospital. Now also, common sense, go to the hospital. Because I once had a couple who really got down the 5 minutes apart for an hour. They really got that down very clearly. So her labor started off like it normally does, about 20 minutes apart, and then it got gradually closer, 10 minutes, and then 6 minutes, and then 4 minutes, and then 2 minutes. And then they finally called the doctor and said, she's having a hard time. They're 2 minutes apart. And he said, why aren't you at the hospital? And you know what he said? He's waiting for them to be 5 minutes apart. So realize they can skip 5 minutes. I just want to make that disclaimer, because common sense is very important in making decisions. So when you feel like you need to go to the hospital, go to the hospital. But generally the 5-1-1 is a good guideline. 5 minutes apart, 1 hour, and they're lasting about 1 minute. So looking at lying down does not make them go away. And try sleeping. If you're in early labor, you need some sleep anyways. So try to sleep through the contractions. Don't worry, you're not going to wake up and go, what's that? There's a baby. You're not going to sleep through it. So if you can sleep through these early contractions, you need to be sleeping. And wait until they get stronger and closer to go to the hospital. When you're in true labor, you do feel them kind of radiate to the back, where the false labor is more just in the front. But the most helpful up there is real labor is going to get closer, and it's going to get regular and stronger. And activity does not make them go away. So those are the two strongest ways you're going to know that you're in real labor, is those two guidelines. The other ones are true as well, but you'll really put it through that criteria. Are the contractions getting closer and stronger? And will they continue when I change activity? So the day you go into labor, it's going to be the better part of the day. Like, we started this class at 9 o'clock and in the morning, and we'll be done at 5 p.m. in the afternoon. Now, if this was real labor, would that be a short labor or a long labor? A pretty short labor. Yeah, you're right. So even if you have the shorter version of labor, it's going to be the better part of the day. Now, it's probably going to be more comfortable if you move forward, Fatima. Fatima. Oh, it's your back?
Yeah.
And you know what? Can you get help? Brenda can help you get in position. You want to try like leaning over the ball if your back hurts?
Oh.
Try a different position. Are you sure?
Yeah, that's fine.
Okay. Because I just don't want you to fall back on the ball, like roll. With the balls, one thing I would suggest with the birthing balls is practice with them when you're pregnant, and then you'll use them when you're in labor and find out what works best for them. But there's so many different positions you can use with the ball. And another position that might work really well, do you want to show her JC over there against the wall? Do you remember that? Okay. And Apollo, you want to help? For the back labor? You're gonna say? Now, you can take that birthing ball and put it against your back, and you can rock back and forth. And some women like that. You might want your stance a little bit farther apart, so you can like lunge even.
I didn't like the lunging.
You didn't like the lunging? You like it closer together, okay. But that puts that pressure in your back. That's just one position that you can use. And then JC, now when you get tired of that, come on back. That felt good?
Yeah.
And JC, you want to demonstrate like the hands and knees? And that would be also good. And this is an all-day blast class, so please change positions as whenever I'm, and kind of lean forward. And then you can do a lot of back massage, like that one. Yeah. So don't feel like, as I say, sit on a ball that you have to sit with. You can do anything you want with that ball, like get in different positions with it. And then the coach can, Apollo can like, rub the back, right? Double hip squeeze, right? Awesome. So we're talking about, this is going to be a long day. You're not going to want to stay in one position all day. You're not going to want to sit in a chair all day, lay in a bed all day. So during this day, you're going to go through, stage 1 is when the cervix opens from 0 to 10 centimeters. And that part of labor is where you're going to spend most of the day in labor. But it's divided into 3 phases: early phase, active phase, and transitional phase. And they divide up these phases by how far you're dilated. That's how they make the decision. And I have a cervical dilation chart over here to show you. Again, this is the life-size version. In early labor, you're going to go from 1 centimeter all the way to 4 centimeters. So it's about the size of a Cheerio to a banana slice. And this will take the longest part of your labor, is getting to 4 centimeters. That's the longest part of your labor. When you arrive at the hospital, your contractions usually are going to be 5 minutes apart or less, and they're going to be lasting around a minute, and you're going to be going into active labor. This is when you're going to be dilating from 5 centimeters to 7. This is the active phase of labor. So during this time, you will go from the banana slice all the way to an orange slice. And then transition is the end of stage 1. You're dilating from 7 all the way to 10. And this usually is the fastest part of labor. So you go from the orange slice all the way to the grapefruit slice. And then the cervix is completely open and it's time to push. So that's what we're going to be going over now. We're going to be going over what to expect as you go through early phase, active phase, and transitional phase, and what you can do to help yourself, moms, and what your partner can do to support you during each part of these phases. So, in early phase, a lot of early phase is trying to figure out, am I in labor or not? So one way you can determine if it's time to go to the hospital is timing them. So as I'm talking, we're going to be starting to do contractions because contractions in early labor are very far apart. So they could be 20 minutes apart, lasting for 30 seconds. So we're going to do contractions that are going to be far apart, like you were in very early labor. What's your personality like when you're in early labor? Excited and nervous and anxious, but also happy to get the show on the road, right? You're having a baby, you know. So, and you're very social. You're like, see, she's smiling, her mouth is open, she's talkative, you know. She wants a lot of attention. She wants you coaches to help and do whatever she says, basically. If she wants you to bring her this, watch this show on TV, go shopping, she just wants you to, you know, be supportive and be there. But she wants your attention and comfort technique. She might want her back rubbed, she wants something to eat, she wants something to drink. So you're going to be very busy during this time, really distracting her by doing activities that she wants to do. So, timing contractions, I'm going to do the first contraction. And what you're going to do is just time my contraction. So just watch me, don't try to do the breathing. But you're going to be timing, looking at the clock on the wall. We have clocks on both sides. When my contraction starts, like if it started at 11:01, you would keep that in mind. Then keep how many seconds it lasts from beginning to end, okay? Now you know when my contraction begins because when it begins, I'm going to take a deep breath in through the nose and out through the mouth. And that's called a cleansing breath or a centering breath. So when I feel the contraction, that's what I do. And then I breathe in through the nose. Abdomen rises and out through the mouth. Slow, deep breath. Abdomen rises on the in-breath. Falls gently on the exhale. And I breathe at my own speed. When the contraction's gone, I take a deep cleansing breath at the end. So, can you give me the time that I'm going to write up here? When did it begin?
11:02 and 14 seconds.
Okay, 11:02, but I don't have to write the 14 seconds. I just write 11:02. What was the duration from beginning to end? Was it 60 seconds? Okay, so 60 seconds would be the duration. Now that's 1 minute contraction. We were talking about 5-1-1. So 60 seconds is a good contraction, but I don't know if it's time to go to the hospital because I have to wait and look like when is the next contraction. So frequency is from beginning to beginning of the next. And when you see the contractions 5 minutes apart or less for an hour, then that's significant. Or something else is happening, like my water bag is broken, then I would go to the hospital earlier than that. But if I'm going just by the frequency, I'm looking for a pattern of about 5 minutes apart or less for an hour. So here we have our happy faces again. So we're in early phase labor. We're happy to be in labor right now, right? And can you thought about things that you might want to do in early labor besides shop, sleep, and shower is really important. Hit that, let that water hit the lower part of your back. It feels great. Things that distract you, getting on the internet, you know, bidding for, I had one couple that she had to try to get airplane tickets for her mom to come to see the baby. So she was spending a lot of time on the computer, and by the time she got the tickets, she'd, you know, gotten through about an hour of labor. So that was good. Every hour is hour less, you know, so all the contractions you do at home are contractions you don't have to repeat at the hospital. So you're always moving forward on your labor. Now, active labor is when you're dilating from 4 centimeters to 7. That's going to be a very intense part of labor. You notice that the mom is not happy anymore. She's not smiling. So you would expect mom not to be very talkative. She goes very inward during active labor. She's much more serious. She doesn't talk very much. You have to pick up what she needs from her nonverbal cues. Like, is she hot? Is she cold? Does she need to move? So the coach at this time, your role changes because you are actually helping her with each contraction. You're helping her with the breathing techniques. You're giving her information about how well she's doing and how well the baby's doing. That's active labor. So don't expect her in active labor to say nice things to you, coaches. Like, I love you, you're doing a great job. Probably not going to say that. Yeah, but they need to say that to you. But it's like, you don't get a lot of thank yous when you're in active labor. You will get the thank yous later. But in the middle of active labor, she is totally engaged on what the work she is doing. And she needs you to, you know, constantly reassure her. Your presence, just being there. But all the little physical things you can do, like the ice chips and the lip balm and the hot and the cold compress and fanning her, all helping her change positions. That's all what the coach is doing during this part of labor. Now, this part of labor is more predictable. Where early labor is the most unpredictable in length. Some people have short early labors, some people have long early labors. On this chart, it has up to 12 hours of early labor. So this part can be unpredictable in length. This is more predictable. Active labor is probably somewhere between 3 and 6 hours. You're maybe making as much progress as 1 centimeter an hour during active phasal labor. So the role of the coach now is as comfort techniques to get her through each contractions and help labor progress. Now transition. This is the fastest part of stage 1. Thank goodness, because it's also the most intense part of labor. This is when the contractions peak right away, so there's less time to kind of acclimate yourself to the contraction. They get to the intense part, the peak, very quickly, and they stay there. And there's very little rest between the contractions, maybe 30 seconds rest, and then you get another contraction that's very intense. This part of labor you dilate is the quickest part. It could be 20 minutes. It could be up to 2 hours. But this is, compared to the rest of labor, one of the most quickest, is quicker than active or early phase labor. So this is transition in stage 1. Now, what's her personality like then?
I hate you. You did this to me. I want you to leave, but you can't leave.
So all over the map, right? It's like she could be. She basically needs so much encouragement. She just wants to give up, go home. This was a stupid idea. You should have had the baby. I'm just done. I'm done. I don't want to do another contraction. So what do you tell her right now in transition?
Yeah.
You're doing great.
You- She's look at all you're doing so well. You are almost done, right? You're almost there. It's like the finish line. It's like you're running the marathon, and the finish line is right in sight. Take one contraction at a time. Help her through each contraction, one more contraction at a time, and remind her how close she is to the part of the end of stage 1. When moms get to stage 2, they usually get a break. Usually there is often even 10 or 15 minutes of rest between pushing and getting to full dilation. Sometimes there isn't, but even if there is not a break between stage 1 and stage 2, the contractions are usually 5 minutes apart. So she gets about 4 minutes rest between these contractions. And many women get another, like they may get a second wind going into pushing. And now it's like, oh, now I get to push the baby, and you're actively involved. Some women go into stage 2 really tired. And again, you know, what's going to motivate them is this is the very end. And every time you push, that baby's coming down closer to your arms, the pushing. So stage 2 is usually anywhere between 20 minutes and 3 hours, but usually it's about 1 to 2 hours pushing. Now, since the contractions are 5 minutes apart, if you push for an hour, you will push for 12 minutes. 12 minutes of pushing. So again, it could be 20 minutes. My first baby was 4 contractions in stage 2. Every labor is different. Every labor is different. So when you look at these charts, sometimes you think like you can control this and it will all be fit perfectly in these little sections, but just remember that your labor is unique. And this does help you understand where you are in labor, but to really realize too that each labor is unique and it will vary. Each of these phases of stage 1 will vary and stage 2 will vary with each individual labor. Okay, so contraction. I'm going to have you do the next contraction. When you have the next contraction, this is what you're going to do. Coach is going to massage your shoulders, because you're in a good position for that. This is called a kneading massage, right? And you can either close your eyes or look at an object. It's called a focal point. So let's go ahead and try that. Now, when contraction begins, you're going to take a deep cleansing breath. And that's it. Deep breath in through the nose and out through the mouth. And it's not just a deep breath. It's take a deep breath in, bring in that life-giving energy. And as you exhale, make your whole body very heavy and soft. And then start your deep breathing. Okay, contraction begins now. Take a deep breath in and exhale slowly and completely. Breathe in through the nose and out through the mouth. Good job. Your abdomen rises gently on the in-breath and falls on the exhale. And now the contraction's over. So take a deep cleansing breath. Celebrate. If this was real labor, you go, it's over. I did it. Now, the cleansing breath at the end is important too, because it kind of lets go of the work. And the cleansing breath in the beginning is really changes your whole, concentration and the feeling of your body, because you're just kind of welcoming the contraction and you're letting your body be soft and heavy all the way down to your toes with that cleansing breath. So coaches, when did it start?
11, 12,
And how long did it last?
40 seconds? Yeah, 40 seconds.
You guys are masters. Now, what would the frequency of the contraction be? 10 minutes. So that's real normal for early labor, isn't it? And you're like right now, we're kind of doing normal stuff. That's what you do in early labor. You're watching TV or you're on the computer, and you just continue doing the normal things. And you don't have to write down every contraction or log it onto your phone if you're using your phone instead. When you think they're getting close and you think, it could be time to go to the hospital, that's when you want to time them. Because remember, early labor could last 12 hours. You're not going to sit there and write 12 hours of contractions down. That would be crazy, So just write them down when you need to. Now, we're going to give you, while you're waiting for the next contraction, I'm going to give you a preview of what your cervix is doing. Because I found a lot of women, they say what helps them in labor is they visualize the cervix kind of melting and kind of opening a little bit with each contraction. So this is a model that we show how your cervix dilates during labor and how it goes through stage 1, stage 2, and stage 3. So I'm going to go through that with you. Now this on the model represents the fundus. This is where the power of your contractions come from. So when you have a contraction, the muscle fibers of the uterus tighten. And when they tighten, they actually contract, which means shorten. And when the contraction's over, the uterus relaxes. And that is a contraction. This part represents the birth canal, the vagina. And the vagina is stretchy and it also accommodates the baby's head well. This, I'm going to pull back the vagina. This part of the model represents the cervix. Now the cervix is that long, thick part of the uterus. The cervix is the neck-like portion of the uterus. This has to efface to 100% and dilate to 10 centimeters so you can start pushing. So I'm going to pull back the birth canal. So this is the birth canal, but I'm going to show you how that cervix dilates during labor and effaces. So in your mind's eye, remember that there is a birth canal right there. But this represents the cervix. So when you have a contraction, what you're feeling is the uterus is contracting. The muscle fibers contract. And when the contraction's over, the uterus relaxes. But over time, it doesn't quite return, to the original length. So the first thing that you notice is the cervix is beginning to efface. It's flattening. It's shortening. See, it was as long as my thumb, and now it's half the length. So this mom is 50% effaced. She's also 1 centimeter, 2 centimeters dilated. So she's in early labor. And during early labor, the progress is slow. Contract, relax. But slowly, she's making progress. Over the hours, that cervix is changing gradually. So when they're about 5 minutes apart, she calls her physician and they say, come on in and we'll check you. She's about 60% effaced and she's about 4 centimeters dilated. So they may go ahead and admit you, or they may say go home and come back in a little bit later. But so labor is progressing. Now, active labor, contract and relax. Mom starts to dilate faster because the contractions are coming closer and stronger. Now they're coming every 2 to 3 minutes. They're lasting a minute. So you're making more progress. So when the physician comes in and checks you this time, you're almost 100% effaced. You're about 80% effaced. You're about 5 centimeters dilated. So you're doing very well. It's still going to be a few more hours, but you're still in active labor, but you're really progressing well. Contract and relax. So during active labor, moms are going to need to change positions, and changing positions often helps labor as well. A lot of women will find squatting as well, lunging. One thing, like JC said, that she didn't really like the lunging. Other moms love the lunging, they love the squatting. Leaning forward is a good position. Leaning forward. And then working with your contractions. So when you have a contraction, remember the uterus contracts and then it relaxes, but it doesn't quite return to its original length. Look, I just moved around and look how much progress I made. So getting out of bed. Now the physician comes in and says, whoa, look at that. In just a few hours, you're all the way to 8 centimeters. You're 100% effaced. Now it's time for transition. So contract and relax. Now these contractions are back to back, so that's why this part of labor goes even faster. And then you go, I've got to push. And then, wait, let me check. Okay, you're almost there. You're 9 centimeters dilated, so it's just a little bit longer. Just a little bit longer. Maybe, here comes the next contraction. Just keep breathing. You're doing great. You're doing great. And you say, I am pushing. And they said, okay, let me check. Okay, you are completely dilated. Perfect. Now, see the position of the cervix? It's back by the baby's ears. It's 100% effaced, so mom is now going to push the baby down the birth canal. Okay, let's add the birth canal. So she can push the baby down the birth canal. Okay, so this is stage 2. Take a deep breath. Take another deep breath. Push low down in front. Push. Push. Now some women like to hold their breath and push. Taking breaths as they need to. Push, push, push. Don't push in your face. Push all the way to the bottom. Contractions over and rest. Now remember, you got about 5 minutes resting between these contractions. Now when the next contraction comes, I'm going to start with my cleansing breath. But this time, I'm going to push with a slow exhale. Some women do better. It's more natural to them to make an exhale when they push. Contractions over and rest. Okay. Now I'm shortening these contractions because they would be about 60 seconds. But whoa, look at that. I can see the baby's head. Now when you can see the baby's head through the vaginal opening and the contraction is over, that baby is made that turn around the pubic bone. So they're going to be born very soon. So this would be a good time to, do any of you want a mirror when the baby's born? That would be a no. JC said no. Maybe. Anyone want, you want a mirror? If Brenda could have one more baby, she would have a mirror. How about touch the baby's head? Does anybody want to touch the baby's head?
Touch it when it comes out.
Okay.
Maybe.
Maybe. JC says maybe. Now, my daughter-in-law, when she was having her baby, I asked her if she wanted a mirror, and she said, no. And I said, do you want to touch the baby's head? And she goes, yes. And she said that really helped her a lot, because she said when she touched that baby's head, she could realize that that baby's right there. And it's your baby, folks. So if you want to touch their head and say, come on, sweetie, it's the next one, you can do it. Because remember, between these push contractions, you have a rest of could be 4 minutes, could be 5 minutes. So it's a little bit of a time that you can decide if you want to see the baby's head or touch the baby. Here comes the next contraction. Push. Now again, you can do breath holding or breath releasing. I'm going back to the breath holding. Push, push, push. Sometimes they count 1, 2, 3, 4, 5, 6, 7, 8, 9, 10. Push again. 1, 2, 3. Okay, stop pushing. Pant. Blow. Pant. Heads out. Woo! That feels good. Actually, it would, if it was real labor, it would feel good. Heads out. Now what happens? The baby exteriorly rotates into position. First shoulder's delivered, then the posterior shoulder, and then the baby slips out. And baby goes right directly on my chest, where I say, hi. Hi, sweetheart. Now this is when you want to talk to them, right? And because they recognize your voice, we talked about that. This is the golden hour. This is the holding your baby. So, what's next?
The doctor cuts the umbilical cord.
The doctor cuts the umbilical cord? It depends. The midwife can cut it, the doctor can cut it, or you can cut it, coaches, if you want. Now, they'll clamp it for you, and they give you a pair of scissors with blunt ends, and you cut between the clamps. There's no nerves in the umbilical cord, so nobody feels any pain. But you know, that's optional. That's something you put on your birth plan, and there's no extra charge. They cut the cord. So what feels like cutting through a hose connected to your fridge. It's tougher than you think. Whoa! And now, that's the end of stage 2. But we still have another stage. What's that stage? The delivery of the placenta. Now, usually in about 5 to 15 minutes, the placenta will be delivered. Now, when the placenta is delivered, you wait. You know, right now we're bonding with our baby and we're waiting because the uterus has to clamp down and contract. It contracts where the placenta has been attached. So it basically, you wait till the placenta peels off the uterine lining. And then you'll feel like this little urge to push. And you may not even remember this because you're so busy with the baby. Who cares about placenta so much? But voila, there it goes. And the placenta will be usually very easy to deliver. When you look at the placenta, you'll see that one side looks like a surface of the moon and one side is shiny. This has been baby's home, the amniotic sac. The umbilical cord is usually about 21 inches long, 3 vessels in it, provides the baby all the oxygen and nutrition during the whole pregnancy. And this is delivery. Check, make sure the placenta is complete. And massage the uterus. The uterus continues to contract down, and it feels like to about the size of a grapefruit. And you feel very thin right now because you've gone from being pregnant to baby. And it's amazing. And that's the stage 3. So that's the journey. We call it the stages of labor, all the way through stage 1, stage 2, pushing, and stage 3, delivery of the placenta.
I
Yes.
just had a question. For like delayed cord clamping
Yes.
or cutting the umbilical cord, do you wait then until the placenta is delivered so you can see that it stopped
No,
pulsating, or
yeah.
no, you'll be able to see it before?
Yes, you'll be able to see that usually before the placenta is delivered. And so usually the placenta is more like 5 to 15 minutes. So usually the cord stops pulsating before that time. And that's when you clamp and cut it. Now, we do have a cord donation program here that they'll explain to you when you're in labor, because you can't sign up for it ahead of time. But if you're a good candidate for that and you want to donate your cord blood, they'll go over that procedure. And that will also mean they'll have to watch the timing of the cord clamping to make sure they're getting enough of the sample of the cord blood as well. So they'll go over that procedure with you. But that's one option you have at TMC, is that you can many times donate the cord blood if you want to do that.
I have a question.
Yes.
Is it possible for mom to cut the umbilical cord?
I think it's possible. I've never had a mom do it. I don't know why it's not possible. Brenda, my expert, have you?
Yeah, there's no reason
Why not? I mean,
if it's long enough.
yeah.
That's fine.
If you're in a position sitting up where you can do it, why not? That's a pretty good idea. Why not? JC, you would be the first. Why not? That's a very good question. There's no reason. So proud of you. But that is because I can't see any reason why not. But that one thing on that, I would say, put that on your birth plan, discuss it with your care provider ahead of time. And
Coach is completely fine with that.
and I can't see why not. Yeah, you're right. So let's go to, now we've gone, our next contraction. Are you tired of sitting on the ball? Okay, we'll do one more contraction on the ball. And then I have to take you. We can sit on, but you can sit on the ball all afternoon. Okay, now do you want to tell your partner to rub you in a different way? Or I said kneading massage last time. Do you want more of an effleurage, which is like a tummy brushing massage? And the coaches are going to time into the music, yeah. We're going to start adding some music, but we'll kind of turn it, we'll only have it on during the contraction. You want to operate the music? Thanks. Okay, so the contraction begins again. Take a deep cleansing breath. And then exhale. Perfect. Breathe in through the nose. And out through the mouth. Let your abdomen rise on the in-breath. And fall on the exhale. Your shoulders are heavy. And your fingers very soft. Contractions over. Take a deep cleansing breath. Make it different. More like a sigh breath. It's over. Okay, contraction. And how long did it last?
50 seconds.
So, what's the frequency? It's how much? 18 minutes. Remember, I said they could be 20 minutes apart, so 18. I mean, this is early labor, right? So we have time to pack our bags to go to the hospital. Now, this is all on your handout, so you don't have to write any of this down. It's all on your notes for you. But sometimes people like it if you just show them some of the things, okay? And you can individualize it a lot. Okay, so when I'm in labor, this is a different kind of a tool. It's actually for the cold. I don't have it cold right now. You freeze a water bottle, then put it in a sock. And this makes really excellent back pressure, but it's also cold as well. We have focal points. Sometimes you bring your focal points. Sometimes people bring a baby happy birthday balloon or something as their focal point. I just got a star, but we have to bring food for the coach because the coach will need to eat. But do not bring anything that makes you jealous that they're eating it in front of you. So, and don't bring anything that has a really bad odor to it, like a tuna fish sandwich, because you go, breathe with me, honey. It's like, can't handle that. So, pick out some food that will last. It doesn't have to be, in the fridge. That will keep their blood sugar from crashing. Women usually like heat and cold on their back. So these go in the microwave. They're really wonderful. They usually have lavender scent. You can buy them in different kinds of scents. You can also freeze them, and they can be cold packs. They come in different sizes. This is an old-fashioned hot water bottle. Works pretty well on your lower back. Sometimes after the baby's born, moms like a little heat on their tummy, as they're having after birth contractions, as the uterus contracts down. Some other things people bring. Back tools. Now, I think it's nice to have back tools for the coach because then it gives them the idea they're supposed to use these things, So if you have like a toolkit, And practice these things at home. Now this is two tennis balls and a sock. Makes a really good back tool. We're going to practice with these in just a second. After I go through this, I'm going to have you sit in the chair backwards, and we'll have the coaches take some of the back tools and use them. Here's another thing, a focal point. Maybe it's baby's first toys. I brought a lot of different focal points over there. If any of them speaks to you today, you can use that as one of your little focal points. Music works well. You can play your own music in the room so everybody's hearing it, or you could just put it on your iPod and just kind of go into your own little world of music. I would select your music, practice with it at home, use it as part of your daily massage techniques and relaxation techniques. And then when you play that same music in labor, you'll go back to that state of deep relaxation by just hearing it. It's very powerful as helping you get into that relaxed state. Simple things that you would never think of but do make a difference is moms sweat in labor. They get hot, they get cold. So you want to bring what would work well to pull the hair out of your face. Soft ties are usually better because you don't want anything hard on your, to lay your head on. For your feet, you want to be able to get up and walk around, so like slipper socks that have the grippers on the bottom. Those are really nice. I just bought these. Aren't they cool? I got pink and blue. So if you had a girl, expecting a girl, wear pink, wear blue. But these are nice, warm little, keep your feet get cold during labor. In fact, you tend to change temperatures during labor, hot and cold. Going along to focal points, people bring the pictures of the baby's sonogram. They sometimes put birthday stuff up as focal points because, hey, it is your baby's birthday, so let's start celebrating. And that can, when you focus on that, it can be like inspirational, like the end of this day, you're celebrating a birthday. So you can put that up as a focal point. Hard candy on a stick. Usually sour is better. I brought a lot of suckers over there, but unfortunately I couldn't find the sour ones. But I think most women in labor do like more of a sour taste, so you can pick out your favorite lollipops. Hard candy on a stick works well in active labor, as well as cotton balls. You can take, these are essential oils. I won't take them out right now, but during break, if you would like to smell any of them, I have lavender, I have different types of essential oils. Put a little on a cotton ball, and that basically is a way you can add that scent to the room easily. And then if you get tired of the scent, you can get rid of it very quickly as well. Practice with all of these things ahead.
If you use essential oils and you have like one of the things, will they let you plug it in or no?
Usually, what would you say about, yeah. Yeah, you have to be careful about the outlets and clear the outlets and make sure it's not causing anyone to trip.
Okay.
You can't have anything that, you can't light any fires. You can't have any candles. But you can bring, which I didn't bring, is lights on batteries that are really cool, that don't even have to be plugged in. I like those to add like kind of soft lighting, ambiance in the room. And even those, they have those little candles that actually look like candles that are on battery. So those would be good. So you can plug in things like, but as long as they don't cause any problems in movement or any tripping hazards. So ask about where it would be a good place to plug it in. Mirrors, they have giant mirrors for you, if they can bring out for you to see if you want to see the baby. Actually, you can bring your own mirror, and actually sometimes that works better than having the big pedestal. So some people bring a little mirror along. Massage lotion, oils work really well. I have over there lavender oil, and that works well because massage oil is not to keep mom lathered in oil, it's to warm up the coach's hands. And so the coach's hand glides across mom's body. Very important, 2 toothbrushes, one for mom and one for the partner, because you may get nauseous during labor as mom, and you will want to brush your teeth. And then the coach will want to brush their teeth just because if they eat something, you know, you just want to have a fresh mouth during labor. So bring along your toothbrush. Your lips get dry, so chapstick, lip balm is really good. A brush, amazingly, feels terrific just to massage mom's hair. It's very soothing. And sometimes you bring along little things a coach might need, antacid, Visine for the coach's eyes. I mean, if you're up late and you haven't slept and you think about Tylenol, things that the coach might need to get them through the labor besides food. That's something else you can bring. Scope, gum, you know, Tums. So think of things that you would make, maybe a razor. You know, I think a lot of people will just go with a beard for a couple of days. But I mean, if it really bothers you, then, you know, you could bring a little razor with you as well. So think the coach needs to also pack clothing that's kind of layered, because a mother usually likes the room very cold and you are sometimes freezing. So anything else, Brenda, that you bring in your goodie bag?
You can bring a heating pad. They do let you plug things in if it's not a danger.
I was going to ask, as far as like the hospital gowns, are you allowed to bring, if you have something that's comfortable but medical grade has like the buttons down the back in case you need, okay, and the front for breastfeeding?
Right.
You can choose to wear your own.
Right. Put that on your birth plan, talk to your doctor, but that is definitely an option. And the main thing, it has to be easy access like any hospital gown is, you know. And realize you'll probably go through more than one outfit, just like you would go through several hospital gowns. So we're going to move you to the chair now. Let's sit you backwards in the chair and bring mom a pillow. And coaches, you're going to do back pressure and counter pressure. So what I'm going to have mom do is, like, she sits this way and you sit behind her. And she straddles the chair like this. And then you bring her a pillow so she can lean forward. That's another good position for labor. Now we might have to, I think the back pressure will work well. We're gonna, when we do double hip squeeze, that's good, you got a tool. Come over here, guys, and pick focal points, pick out a back tool. These are the 2 tennis balls in a sock, or you can get 1 tennis ball in a sock. And, you know, just don't think about this, use it all day long. It's not just for practicing for the stages of labor. Okay, so we're still in early labor. We're going to be practicing active and transitional labor more this afternoon. So we're mostly doing labor now when we have a lot of rest time between the contractions. Okay. Oh, that's such a cute little. I remember when I was in labor, I didn't really look at my little focal point, but I just held it. And I, you know, it just reminded me that at the end of the day, there was going to be a baby to get this toy. So you can put your focal points anywhere. Sometimes people look at them, sometimes they touch them. Sometimes they just like to have special things in the room that make them feel comfortable. Okay, so you're doing some back, you're using the back tool on her back. How does it feel, moms? Okay, so tell them how much pressure you want. Do you want more pressure or less pressure? And we'll dim the lights a little bit. Okay, here comes your next contraction. Take a deep cleansing breath, like welcome the contraction in through the nose and out through the mouth. And breathe in slowly. Abdomen rises on the in-breath and falls on the exhale. Shoulders heavy. Now you're breathing in nose, out mouth. Contraction is almost over. Take a deep cleansing breath. Make it different. Coaches, could you hear a difference with the cleansing breath? Be honest. And now, the reason the cleansing breath is done at the end is to let you psychologically let go of the contraction and the work. But for them, it's really a helpful tool, because if you don't do a cleansing breath, they don't know when it's over or when it started. And you're going to be pretty tired of them asking you, like, are you having a contraction? So it really does help. So that was 11:44, I think. Okay. And how long did it last?
70 seconds.
Whoa. Okay, so 13 minutes. Okay. Usually the longest contractions last are about 90 seconds. So 70 seconds was pretty impressive. Okay, but they're still pretty far apart. So we'll wait for our next contraction in that position. And this is what I showed you with the doll. I showed you the stages of labor. And here you can see you'll be home, 1 centimeter dilated, almost completely effaced. Over here, you're in the hospital. You're completely effaced and you're 5 centimeters dilated. So you're in active labor. Now you are ready to push. See that cervix pulled back by the baby's ears, and the water bag is still intact. So it'll probably break when she first starts pushing. Usually your water will break on its own spontaneously before you get to stage 2. But if it hasn't broken, it will at this time, before you get to stage 2, or it hasn't been artificially broken by your care provider, it's going to break as she starts pushing. Now, this position here, the baby is starting to crown. This is when you could get the mirror out or touch the baby's head. It's made that right degree turn around the pubic bone. And then as soon as that baby's head's out, see the rotation I showed you with the model, that first shoulder will be delivered first, then the posterior shoulder, and then the baby is born. And then the uterus clamps down and contracts, and the placenta peels off the uterine lining. So all the tissue there is then regenerated. So you don't have scar tissue where that placenta was previously attached. So the placenta will be time to push the placenta out when it's made that it's basically detached on its own. And then you got your baby. So we're practicing labor and using a lot of different positions. So contraction is back again. Take a deep cleansing breath. Make it different. Perfect. Breathe in through the nose and out through the mouth. Now, when you're breathing in, I want you to visualize you're breathing life-giving energy to your baby. And when you're breathing out, you're releasing all the tension in your body. Contraction's over. Take a deep cleansing breath. Make it different this time. Celebrate. Celebrate. Okay, coaches, can you give me the time?
40 seconds.
And when did it start?
11:47, right?
Okay, so that's 4 minutes. So right now we have had contractions all over the map. 10 minutes, 18, 13, 4. So this would look like very much early labor, or maybe not even labor at all. You know, it could be just a day of practice contractions, but we're having fun. And we're practicing our labor. Now I'm going to have your contractions get closer as we get into more transitional labor. So we're going to try another position before we get up. And that is back pressure and counter pressure. So mom's sitting in the chair. So you're going to hold you're going to hold the hip with your hand like this. Going to support it. And then you're going to press on the sacrum. The sacrum is a triangle bone right before you get to the coccyx bone. Now the baby, during labor, the baby's head is right behind the sacrum. So by applying pressure here, it actually reduces back pain. And moms are going to find that very helpful in real labor. So if you hold the hip and apply the back pressure, and it's not so much massaging. Some moms do like a little massaging, that's fine if they do, but it's mostly pressure. So go ahead and try that now. We're going to see if you are ready to do that through the contraction. Okay, it's more down here, like right there. And then. Double hip squeeze feel good too, yeah. So now, this one is more like right on the sacrum. So move back just a tiny bit. If you move back up, Apollo, I can okay. And so it's right here. That's where that triangle bone is, right there. And then this is the counter pressure right there. Now I've got my hands that would be more in that position. Okay, perfect. Now does that feel good?
Yes.
Okay. Now, what I want you to do on the next contraction, we're going to change the breathing a teeny bit. Instead, I want you to still do the deep abdominal breathing, but I want you to make noise on the exhale. When I say contraction begin, you're going to take a deep cleansing breath, like exaggerated. And then you're going to breathe in through the nose. Abdomen rises, but on the exhale, make a soft hiss. Slow, deep breaths. Breathe in through the nose, out through the mouth. When the contraction's over, then do your cleansing breath. Exaggerate. So it should be a lot noisier this time, okay? So let's go ahead and start. Contraction begins now. Take a deep cleansing breath. Perfect. Breathe in through the nose. Exhale with a hiss. Your face is relaxed. Slow, deep breathing. Shoulders heavy. Breathe. Now really feel that in-breath. Like as you breathe in, you're breathing in life-giving energy to the baby. As you do the hiss, release the tension. Very good. Keep breathing. Contractions over. Take a deep cleansing breath. Make it different. Oh, that was good. That was good. Okay, so how long was the contraction, coaches? 56? 66. Now, when you get to the hospital, we won't be doing timing contractions anymore because you kind of keep track of the duration and frequency, but you're there. Part of the reason you're writing them down is figure out when to go. Because sometimes it can actually take attention away from what mom needs you to do, timing the contraction. Like right now, I'm making you look at the clock and massage your back, and you know, it's a lot to do, you know. Okay, so we're going to stand up on the next contraction. Pick a position anywhere in the room. And you can hold her. Now look at the positions. You can lean on your partner like you're dancing in middle school, like that. That's very relaxing. You can lean into your partner and they can hold your tummy and you can rock back and forth. You can lean on an object. As you can see, I'm really into the lunging thing, but a lot of women do find swaying is just like when you're holding a baby, what do? You sway. It's a very soothing thing. Dancing, think of kind of like dancing. So pick a position. Remember, in real labor, the contraction's there and you just have to respond. So, okay. Contractions back. So take a deep cleansing breath. We're going to do the deep abdominal breathing. Make that cleansing breath big. Exaggerate. Now find your own rhythm. Breathe in through the nose. And exhale with a hiss. Slow, easy breaths, but emphasize the exhale. The exhale, add the hiss. Now, if you don't like hissing, you can add like a he breath instead. But you want to have that auditory sound on the exhale. Good job. Contractions over. Celebrate. Make sure the cleansing breath's exaggerated. Okay, coaches, what's the time? And the duration is?
50.
Okay. So we're going to pretend that your contractions have been under 5 minutes for an hour. And they've been in the ballpark of being about a minute. So we've met the criteria of 511. So we're going to be going to the hospital. And we're going to have our labor room right now. So the first contraction we're going to try is just kind of kneeling. So take the chair and put a pillow on top of it. And kneel into that position. Or if you don't like that position, you can just get on your hands and your knees and just kind of get in this position. A lot of women, you'll find, they'll kind of rock their hips back and forth like this. Another thing that women, or rock back and forth. This is also, between contractions, you can do your pelvic tilts. This is called that pelvic rock, where you flatten the small of the back. So you can also do this position as well. This is a pelvic tilt, like that. You can rock. Okay.
Can I see it?
Yeah, can you what? Can you what?
Can I see it on top of her? See.
Oh, sit. No, can't do that. Now I know we can make you more comfortable. You can get a birthing ball, coaches. A lot of times, or you can sit in a chair, but a lot of times the coaches are on the birthing balls when the mom's not on the birthing ball. And that way, it's a little more comfortable. Now, what would you suggest? There's a couple massages we could do here. We could do a double hip squeeze. This is a really good position. Now, a double hip squeeze. Brenda, you want to do a double hip squeeze on me? Because I would like a double hip squeeze. Because this is so effective for women that are in labor. And you want to talk it through, like how you're placing your hands?
Right, I'm straddling her feet. My hands are placed right on the crest of her hip, elbows out, and I'm pressing in and a slight up, but it's gentle. And then you hold it the whole contraction, because we're releasing the pressure. As soon as the contraction's over,
I can take my cleansing breath.
Oh. Then you gently release because the pressure will come right back.
Thank you.
So we're going to try the double hip squeeze during the contraction. So cradle her hips, kind of cup it with your hands, go up and in. Okay, contractions begun. So take a deep cleansing breath, moms. Breathe in through the nose. And add a sound on the exhale. You can add a hiss or a heave to add a sound, or an ooh. You can make a low sound. Breathe in slow and deep in through the nose. And add a sound. Some women moan. Some women add like a heave. But emphasize the exhale. Contractions over. Take a deep cleansing breath. Make it different. Perfect. Okay. Now we're going to go to a sitting position. We're going to go to the Taylor position. So we're going to have the coaches move the chairs. Brenda and I will move the chairs so you can get your blankets out kind of in the front of the tables. And if you could kind of make your own little, it's kind of like going to a slumber party. Kind of stretch out your blanket, that's your territory. And you're going to sit behind her. So, now ready for the next contraction. Remember, we're not going to time the contractions anymore because we're in active labor, they're just coming every 3 minutes. Okay, contractions back. Take a deep cleansing breath. And exhale. Now massage your shoulders. Breathe in through the nose. And out through the mouth. Perfect. Keep breathing. Contractions over. Take a deep cleansing breath. Okay. Now we're in the hospital. As you get into more intense labor, women might find visualization very helpful. And visualization is like taking kind of a mental vacation where you focus on something that you find very soothing. It could be your special vacation spot. It could be visualizing the baby. It could be visualizing just being asleep and your mind is just at peace and it's just clear. But visualization is a mental focus, and birth is a mind-body experience. So that's why that can be another tool that you use during labor. You've been doing a great job with massaging Mom, and massage is going to reduce pain for her. So the coaches, you've done kneading massage, you've done effleurage. Effleurage is the tummy brushing that you do on the tummy, but remember it can be done any part of her body, her shoulders, her scalp, her hips, her thighs. It's just a light circular massage. And some moms like it to be the first and the last stroke. Like when the contraction starts, you do an effleurage, like here we go. And then they like more of the deep massage as the contraction gets more intense. These are things that you work out together with your partner as you practice together.
And as we're learning all these things in class today, this is for you to practice on a regular basis. Like it should be like a part of your day activities, like before you go to bed every night, put on your relaxation music and practice your massage. This is by far the best massage for labor, is the stroke relaxation. It can be done in any position. Some positions it's a little easier, like she's laying down, but it's long flowing strokes. Come over here, Brendan. Since you gave me the last massage, I'll give you this massage. What position? You can do it in any position. Any position, just so I have something to rub. Okay, so here, I'm going to emphasize the down. See, I come up and then firmly on the down. And you just kind of release the hands. As I go up, it's a nice slow stroke, but as I come down, I'm easing off without stopping, and I'm just letting all the tension in her body just melt away. See, I'm kind of milking it out of her body. See how slow? And see how I release my hands? Take a deep cleansing breath. Okay, so we're going to try that. It's a little harder to do in the sitting position. If you don't want to do it in the sitting, you can change your position. If you're okay for that one, go ahead and do it for one. But we're going to try the long flowing strokes. Okay, contraction begins. Take a deep cleansing breath. Now breathe in through the nose. If you can pair the breathing to the speed, pair the massage to the same speed of her breathing. So as she breathes in, your hand goes up. As she breathes out, you massage down and you pull that tension away from her body. That enhances the stroke even more. If you pair the massage to her breathing, it makes sure you're in harmony with the contraction and her breathing. Perfect. You're doing amazing. And now the contraction's over. Take a deep cleansing breath. Now, in early labor, when we had our contractions far apart, you would have been doing things like saving energy, drinking, eating lightly. Pretty much early labor, be normal activity. One thing that's really important is to keep your bladder empty, because if the bladder is full, you won't dilate. So make sure you go to the bathroom. Now, try that position, coaches. Try sitting back to back with her. This gives you a rest. Now, if we had that hot compress, or a heating pad, or we heated up in the microwave the rice sock, that could be put on the lower back. That would give you a break in back pressure. And this, for some women, feels really good too. Now we're going to change the breathing a little bit. You're going to use the deep breathing as long as you possibly can. But if the deep breathing gets difficult, like it's hard to breathe deep because the contractions are so intense, you may want to try to breathe lighter. And the light breathing is called chest breathing. You're going to breathe equal in and equal out during the mouth. Breathing through the mouth, in and out the mouth. Now we're going to start by just doing the same breathing that you've done before, which is the deep breathing. But at the peak, I'm going to say, move to the lighter breathing. And the lighter breathing will be like breathe in and out your mouth. Put your hands on your chest, Mom. and practice the lighter breathing. Breathe equal in, equal out. You're breathing in mouth, out mouth. This is called chest breathing. And it kind of, you're breathing over the top of the contraction. Some women like to do this just at the peak. And some women, when they get into really intense labor, will use it through most of the contraction, the lighter breathing. So we're going to practice just at the peak. Okay, so we're going to start first with the deep breathing, and I'll tell you when to switch to the chest. Take a deep cleansing breath. And exhale. Now breathe in through the nose. Now I want you to switch to the chest breathing. Put your hand on your chest. Equal in, equal out. And now go back to your deep breathing. It's almost over. Soft, easy breaths. Contractions over. Take a deep cleansing breath. Perfect. Now, I'm going to have the coaches turn around again. We're going to basically do about two more contractions, and then we're going to have a birth film before you go to lunch. Now we will practice the breathing in the afternoon because we're going to do transition and pushing techniques, but I wanted to kind of review what we've learned already today and also what we're going to see in the movie. So we've talked about early labor, about staying home, doing normal things, packing the goodie bag. The goodie bag is called the labor bag. Can you have sex in early labor? Yes, you could, as long as the water bag's intact, as long as it has been approved by your doctor. There's some women that's been not approved, but for most women it is. It may not be on her to-do list, but it's possible. Kissing, hugging. This is a time to be together. This is a time that, spend with massage and relaxation. So this is what makes mom comfortable. Some women want to be alone in early labor, and they don't even wake up their coach. If it's the middle of their night, they just want to be alone. But most women will wake up the coach and say, hey, I want you to know I'm in labor now and help me. So it's up to the mom. But you want to rest, do normal things, and drink water. Another mom said that really helped her was going into the baby room and folding the clothes and getting everything ready for the baby. So when she came home, everything would be perfect. And every contraction you do at home is one you don't have to do at the hospital. So you can do little things like that to take your mind off the labor. Now, when you get to the hospital, you're in active labor. If you get to the hospital in early labor, which sometimes does happen too, then just pretend like you're home. Just do normal things, play games, watch TV, chit chat. But here you're arriving in active labor. Women get very inward. You see, she's very focused inward. So she's basically not talking to you very much. She's getting her own rhythm, her own ritual, like what she wants to do. Maybe it's tapping her hand or her foot. Maybe it's looking in your eyes. Maybe it's holding your hand. But there's usually a ritual, something that's important for her to do. During active labor, the coach needs to remind her to take the cleansing breaths because sometimes she stops doing them, especially at the end. You can see the double hip squeeze here. She may switch her breathing to the faster breathing that we were just starting to learn. She won't know it's time to empty her bladder because she doesn't keep track of time in active labor. So the coach needs to make sure that every hour and a half she's emptied her bladder and really encouraging her to change positions. For moms planning pain medication like an epidural or narcotic, that is given in active labor usually. Sometimes it's given in early labor, and definitely it can be given even in transition at times, like an epidural can be given later than active labor. But active labor is usually the time where most pain medication is given. So don't leave her. Are you to say positive things to her? I know we're not really in labor now, but you may want to practice that with contractions of saying like, I love you. Yeah, give her a kiss after the contractions, because that's what you're going to do in real labor. You know, you're doing really well, the baby's doing really well. When we watch this film of a mom going through labor, you're going to watch the coach, how she helps her. Because when the mom says, oh, it hurts, what does the coach say?
Be strong, stay positive.
You're almost there.
But sometimes you can't say it's almost there if you're 4 centimeters dilated.
Oh, that's right.
So some...
The outcome is better than the pain.
And you do have to acknowledge it. You have to say, you have to hear her and say, what can I do to help? Do you want to try a different position? You know, you're doing very well. The baby's doing well. That was a good contraction. You did very well with it. But I know this hurts. I know this is hard. You have to acknowledge what she's going through too. You can't ignore her and give her suggestions on what she can do. In transition, she's dilating from 8 to 10. Really helps just to take one contraction at a time instead of saying, I have to do this for 20 minutes or an hour. Just say, I'll do one more, then I'll do one more. And that really helps. Breathing with her really helps. So I'm going to help you. We'll get through it together. This afternoon we'll learn about chest breathing with numbers, and that really is one that you can breathe together. She may be very all over the map, very moody. She may cry, she may throw up, then she would be like, she's like happy, and then she's not. So she can be hot, she can be cold. You know, there's a lot of changes. This is a very intense time of labor. I like the way the father is so engaged in that, face to face with her, breathing with her. And again, that position is getting the weight of the baby off her back. So it's reducing her back pain. Things like a cool compress on her face. During this time, she'll be sweating. So if you put that cool compress on her face and her forehead, that will feel really good. Keep a little basin of water with ice in it. Then cool compress, squeeze out the washcloth so it's not dripping, but it's really cold. And that's what you want to use for your cold compress on her face. Use hot compresses on the back. Again, that water bottle that's frozen would be really good for the cold compress. And your nursing staff is there to help you. And they have seen so many women in labor. I remember when I was in labor, the nurse said, I got to a point in labor on my first baby. I said, I can't do this. Give me an epidural now. And my husband said, what? He didn't know what to say. So the nurse said, you know, Margie, she said, you're doing really well. You can make it. But you can have the epidural now if you want, but you can make it. And that really helped me because I refused to talk to her or my husband at the time. I'm not talking to anybody. But the fact that she said I could make it really helped me because I thought like, he's never had a baby. So it's like, but if she said, you're going fast, you can make it. I said, that made me feel empowered. It really did help me. So the nursing staff is there to help you. And your voice needs to stay calm and confident, because, you know, if you're nervous, relax, relax, you know, that makes it, she can't relax to that. It's your voice, soft and soothing, supportive. That's going to help her. So we've been doing the deep breathing, because the deep breathing is what you're probably going to use for 90% of your labor. Chest breathing, we're going to practice this afternoon, is used for active or transitional labor. But chest breathing, you can use that chest breathing throughout most of it, or just at the peak, right here. I had you do that last contraction where you did chest breathing right at the peak only. And then this afternoon we're going to learn pattern chest breathing, which is really good in transition. We talked about packing your bag and all that. So you'll all be ready. So let's do one more contraction. Choose your favorite position. On this one, we're going to practice some chest breathing at the peak. So go ahead and, if you want to lay down, or you can sit up. And when you're in real labor, what's going to happen is we're practicing the popular positions in class, but in real labor, what's going to happen is you're kind of going to go back to the ones that work best for you. You go like, you know, yes, we did that in class, but I want this one. So, and contraction begins. So take a deep cleansing breath. Let all the tension out on the exhale. Breathe nice and slow, easy, in through the nose and out through the mouth. Drop your shoulders, soft shoulders, soft fingers. Now the peak is right here, so I want you to go to your lighter breathing. Breathe in and out. Breathe in through the mouth, out through the mouth, which takes you over the peak. And now go back to your slow, deep breathing, because the contraction's coming down now, so it's getting much easier. So you just breathe the contraction away. Slow, deep, easy breaths. Contraction's gone. Celebrate. Take a deep cleansing breath. Okay, perfect. Okay. What we're going to do is I think we'll go to lunch right now. We'll be at lunch for 45 minutes. When you come back, we're going to start with the birth films.